I'm in between surgeries and I just want to set the record straight on some liposuction myths, okay? I get a lot of patients who schedule consultations to see me or send me inquiries that they just want liposuction or they want a liposuction at BBL, and there's nothing about having a tummy tuck or anything like that. And I just want to set the record straight on this because there are very few patients that I see who can just have straight liposuction and no tummy tuck or skin removal, okay? And I think that there's a lot of plastic surgeons out there who are really guilty of trying to make it appear that the patients do fine with those procedures alone, when in fact they don't. So a couple things to consider, okay? Number one, when you lay a patient down, they automatically look better laying down than they do standing, okay? Number two, when we take those post-op pictures, a lot of those pictures are patient selfies that can be manipulated. They're not standardized pictures, or they're shown a short amount of time after surgery where the tissues are very swollen still. When tissues are swollen, the swelling hasn't gone out and you don't see that loose skin. There's a lot of irregularities that occur in the abdomen when you do liposuction alone, especially in that central abdomen right here. Around the belly button, if you look closely, the skin's a little different there. Women really get disfigurement in that area. So we actually have to be really careful doing liposuction in that area, as opposed to what you see where surgeons are trying to aggressively remove that tissue where we can remove it with skin removal. So, if you've had kids or if you have any amount of loose skin or stretch marks on your abdomen, you most likely are not a candidate for liposuction. I believe in lifetime procedures. What does that really mean? That means that when a woman comes to see me, or a man, and they want a procedure done, I believe in doing the best procedure long term. So I don't want to do liposuction on somebody and just kind of be like, okay, we'll do what we can do. If you don't like it later, we can do a tummy tuck, right? That's not how it should be. If we think we need skin removal, if there's any question about it early on, 100% of the time you're going to need skin removal with liposuction. We're creating a weight loss on the table. And so if you lose 30 pounds acutely, that even if you have pretty decent skin, most likely your skin is not going to tighten. And I also want to set this record straight about the technologies out there. These are myths, people. Do not be fooled by technology. I mean, we had laser lipo. Hardly anybody does it anymore. I see these things like Renuvian or J-plasma. Look, guys, skin is going to tighten based on the properties of itself. If you have a thick dermal layer to your skin, you're going to tighten better than others. All right? It has nothing to do with products out of a box. They will not do anything to improve skin tightening. Really, only skin removal is going to improve that. So if you do not be fooled by these technologies, okay? I swear there's a lot of patients who probably know they need skin removal, who just convince themselves that they can have J-plasma or Renuvian and they'll be fine. And guess what? You're not going to be fine. And you're going to end up paying double when you come back and you've got to have your skin removal and have it redone. Having liposuction and then having to have a revision procedure with a tummy tuck is extremely difficult. I saw 2 of them last week. A lot of times they liposuction in the wrong areas. They actually liposuction the opposite of how they're supposed to, and you just can't ever get the result. And yeah, your skin tightens some, so I can't remove as much skin, so we have more visible scarring than I could otherwise remove more skin and get a better result. So remember that there are very few surgeons that are skilled in liposuction. I'm talking less than 100 in the world, right? And probably less than that, honestly. In the United States, less than 50, maybe less than 20 from what I've seen. So you've got to find the surgeon who is an expert at liposuction for any body contouring procedure you do. All right. Look for standardized pictures. Make sure they're like at least 3 to 6 months after surgery. Do not be fooled by patient selfies or how people look in clothes, because without clothes on, they don't look good, and they're never going to wear, bikinis or anything like that and show their abdomen. So make sure that your surgeon's board certified and you're doing these in safe places. Liposuction can be a dangerous procedure, and it should almost always be combined with some sort of skin removal procedure. If you follow those instructions, you'll do really well, and you'll have a lifetime of a good result to enjoy, and not be one of those patients who's trying to get revisions and we can never get it quite as good. Thanks.